If we've got someone coming with shoulder pain, as a myotherapist, we'd be looking at a number of different areas and regions that will be then contributing to a potential shoulder pathology. A lot of the time, and what sets myotherapy apart, is that we don't just look at the symptomatic spot in general, we're looking at the whole unit that could be causing pain at this particular site. So often what happens is that people they get the site treated and it feels better for a little time, but then it ends up coming back inevitably. And that might be because the range isn't enough, and it might be because the strength isn't enough in particular regions. So we might be testing things like shoulder external rotation, which is very important and one of the foundations of shoulders, just simple at 0 degrees. And then we might have another one at 90 degrees here. We can test certain tendons, push up like that, but we can test another group of tendons by turning it over, push up again. And something like that can be really powerful. Then want to be testing what's happening at the posterior rotator cuff. Does it have the strength to do what it needs to do? And we want to be checking the range from the muscles, not just the joint itself. Is it the muscles that are really tight? So what would limit external rotation is internal rotation, and that will generally happen from your pecs, as well as some of your muscles that are in your armpit, essentially, that pulls everything in. And you might get a lot of that as a desk worker, or even a nurse or a dentist, or something that's sort of over a hunch for a long period of time. So it's not just desk workers, it's a whole range of different people, and they can get really tight through here, which then limits the way that the shoulder can move. So do we have the strength? Do we have the range? And generally, if you've got strength and range, then most things are going to be treated. But you might be getting pain here, but maybe the problem is actually coming from over here. You want to also check the spine. Is the spine working well enough? Because a lot of our shoulder movement actually happens from our spine. So if I'm in a sort of hunched position and I'm wanting to bring my arm up, that's as far as it goes. It just blocks. But then I lift my chest and then it goes all the way up. So if you've got a really stiff thoracic spine, then that can involve your shoulder as well. It can even go down to your glutes. So if you've got weak glutes, then on the opposite shoulder, there can be a problem. So if you've got a shoulder pain on this side, we will just make sure that we're also integrating rehabilitation exercises on the right side.